Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today I want to talk about the thyroid-SIBO connection. I had a number of listeners and viewers of the Thyroid Thursday videos ask me what is the connection, or if I could summarize the connection of hypothyroidism and SIBO. So here we go. SIBO, just to review it, SIBO is small intestinal bacterial overgrowth. Now, it could also be other organisms as well, but this is the common term. And when you have SIBO, you can have symptoms like gas and bloating, abdominal pressure. You can have constipation or diarrhea. You can have fatigue, aches and pains. You can have weight loss, weight gain. Essentially, you just don't feel well at all. A classic sign that you're probably struggling with SIBO versus just overgrowth in your colon is if you have that gas, bloaty kind of discomfort symptoms within 20 minutes and up to an hour, hour and a half. So if it's over about 2 hours and you have pretty regular bowel motility, the overgrowth may be down into the lower part of the GI tract in the colon. But if it's within 20, 30 minutes or up to an hour and a half, if you're getting symptomatology that soon after a meal, there's probably overgrowth in that small bowel. So is there a connection between hypothyroidism and SIBO? There definitely is. And remember, when we're talking about hypothyroidism, in my world, we talk about cellular hypothyroidism. We don't wait for the gland to become dysfunctional and diseased. We don't necessarily wait for Hashimoto's to occur and the autoimmune attack to occur. If you have hypothyroid symptoms, you very well may have cellular hypothyroidism, which is a deactivation of your thyroid hormone at the cellular level. And this happens for a lot of people, and yet they still have normal TSH and T4 and T3. Blood values are normal, but they have the symptoms. So we look at reverse T3, we look at T3, free T3 to reverse T3 ratios, as well as look at a bunch of stress and inflammatory markers to identify the state of cellular hypothyroidism. But here are 4 ways that cellular hypothyroidism can cause SIBO or lead to SIBO. And one of those is stomach acid production. Thyroid hormone is critical to stomach acid production. Why is stomach acid such an important piece, and why would low stomach acid contribute to SIBO? Well, stomach acid is released when you put food into the GI, into the stomach, okay? So when you put food in, stomach releases stomach acid, and it's the stomach acid that helps break down the food, and it also is what helps kill the organisms coming in off of our food. And yes, there's organisms on our food when we eat it. And so the amount of stomach acid is really important to start the process of digestion. The more stomach acid you have, and the more that acid, and the better that acid works, the more it breaks it down and preps that, what they call the chyme, the stomach contents, to enter into the small intestine. And that chyme needs to get down to a pH of 1 or 2 to properly stimulate the appropriate release of bile and pancreatic enzymes, okay? So stomach acid, really important, and you need cellular levels of thyroid hormone to make stomach acid. Second thing, when you have cellular hypothyroidism, you have a decreased production of bile. So what is bile? Bile is this acid that's produced in the liver, and then it goes to the gallbladder to be concentrated. And then when you eat a meal, and especially fattier based meals, it's really important to have the excretion of bile. Now, what role does bile play in intestinal health? Well, bile not only helps absorb fats and fat soluble vitamins, but it's also a natural innate antimicrobial. So at the upper end of the GI tract, bile directly is antimicrobial, okay? In the lower portion of the small intestine, it acts indirectly as an antimicrobial. So bile health and function is really important to prevent bacterial overgrowth in the small bowel. Many people that I see who have SIBO and have treated it over and over again with antimicrobials missed one important point. They didn't check these things out. Did they have appropriate stomach acid production? Did they support biophysiology? And did they support pancreatic function? If they didn't do those 3 things, they didn't help support the innate antimicrobial capacity of what's going to keep this bacterial overgrowth away once the antimicrobial or antibiotic goes away. So the third reason hypothyroidism, especially cellular hypothyroidism, can cause SIBO is decreased production of pancreatic enzymes. So your pancreas releases insulin to help you regulate blood sugar regulation, but your pancreas also releases a number of enzymes that have a role in proper digestion and antimicrobial capacity, especially in that small bowel. So if you have decreased production or secretion of pancreatic enzymes, you have a greater likelihood of developing overgrowth in that small bowel because you lose the innate antimicrobial capacity of the small intestine. The fourth way that cellular hypothyroidism can cause SIBO is hypothyroidism or thyroid hormone is really important to the motility of your GI tract. So there's plenty of research showing that thyroid hormone plays a role in esophageal motility, in gastric or stomach motility, and intestinal and bowel motility. So as you have cellular hypothyroidism in the small bowel or anywhere in that GI tract, you're going to have decreased movement and motility at times, which allows the bacteria to overgrow because the food doesn't move along in an efficacious manner, and so bacteria has a longer time frame to act on that food and overgrow. So these are 4 ways that cellular hypothyroidism can lead to SIBO. So let's talk about what you can do. One, if you think you have SIBO, you can easily confirm SIBO with what's called a breath test. So Aerodiagnostics is the lab we use. It's a great lab. If you call the lab, a test is sent usually within 24 hours. It's a 48-hour turnaround from the time you do the test, and we can have a confirmation of whether there's overgrowth in that small intestine, okay? Once you confirm that you have SIBO, you really want to follow what's called a low FODMAPs diet or a biphasic diet. And if you kind of Google those links, and if I get a chance, I'll put links with this video, you want to follow these 2 types of diet, okay? These are the things that will keep the food for the bacteria or organisms that are living in the small bowel. If you keep the food content for these organisms down, they won't flourish as much, okay? Third thing you need to do is you're going to have to get some type of antimicrobial support. And typically what I find is I have to rotate antimicrobial support, and we do this over time. And it can take 3 months or more to really truly eradicate SIBO. Fourth thing is you want to use what we call a biofilm disruptor. So organisms have a tendency to live underneath a biofilm, which is like a protective fence. And the longer you've had GI issues and bacterial overgrowth, the bigger the fence. So biofilm disruptors are things that kind of break the fence down, allow the antimicrobials we give somebody and the innate immune system to get in there and start working on killing down or breaking down that overgrowth. Fifth, you're going to need to support stomach acid. You probably want to work with a functional medicine practitioner, but something like betaine HCl, if you know you have decreased stomach acid, something like betaine HCl can help support stomach acid production and start that antimicrobial process at the top end. Second thing, you're probably going to need to look at gallbladder or bile support. And some people like to use ox bile. I like to use, for many people, combination formulas, things like have like taurine in them. But you want to get that bile support in on a regular basis, because until the body is making sufficient bile, you really want to make sure you're supporting it, because bile is antimicrobial. You may need to support with pancreatic enzymes. And so if your pancreatic enzyme function is low, you want to get these pancreatic enzymes in, again, not only to help digest the foods and absorb the nutrients, but also for their antimicrobial capacity. So a really good test to take a look at that I like is called the GI map test. It's a test that checks for the DNA of organisms, and it's not necessarily a small bowel test, but we can get a good indication of bacterial overgrowth in the large bowel. We can also get markers of bile physiology and pancreatic enzyme production when we do a test like the GI map test. So really good test to do, along with a breath test for SIBO. 8, you're probably going to want to have some form of GI lining support product, and that is like a glutamine-based support powder if your body can tolerate it. There's a number of these things that have multiple ingredients in them that can help that GI tract heal and repair. Because not only do you have to get rid of the organisms, you often have to build up the immune system of the GI tract. Things like colostrum can be very beneficial to help support the secretory IgA system, and things like glutamine some of the other products that you'll find in these GI powders can be really helpful to help rebuild the GI tract. The ninth thing, I didn't put it on there, but it may be really important for you. If you have constipation, slowed motility, you're probably going to need to get some type of motility agent, because if you can't move those bowels, then it's hard to knock down that organism. So if you have constipation, you can use things like magnesium citrate. Different people do better on different forms of magnesium, but magnesium citrate is one of those ones that can be really beneficial. You can do things potentially like a vitamin C flush to find out how deficient you are in vitamin C, and increasing your vitamin C can help with motility. Things like 5-HTP, or a product called serotonin that's got a combination of 5-HTP and some other factors to help with serotonin production, because serotonin is really important for bowel motility as well. So there's about 9 things that you can do to help improve yourself if you have SIBO. Now, I don't typically go directly at trying to get somebody's thyroid hormone levels up if they have cellular hypothyroidism, or glandular hypothyroidism if they have SIBO. Typically what we want to do is try and support the acids and the enzymes first, get the dietary changes made. Then we want to get rid of the organisms. And as we do that, we reduce the stress. And as we reduce the stress, then we reduce the cellular hypothyroidism. So we don't have to try and force the thyroid physiology. If the body's already deactivating your thyroid hormone and you give the body more thyroid hormone, it's just going to have to work harder to deactivate all that thyroid hormone that you're giving yourself through prescription. Okay? So address the SIBO first, antimicrobials, bowel motility, make sure you have acids and enzymes supported, and then over time, as you get healthier, you can do a retest, make sure you've knocked that down, start reintroducing foods back, start weaning off of the antimicrobials, start weaning off the acids and enzymes. And if you do these things in the right fashion, not only will you address your SIBO appropriately, but you'll probably see your hypothyroid symptoms clear, because as you reduce the SIBO, you reduce the stress that's actually causing cellular hypothyroidism. Okay? So last piece, stress triggers cellular hypothyroidism. Stress can also trigger dysbiosis and an imbalance of bacterial flora. Cellular hypothyroidism leads to decreased acids and enzymes and decreased motility. This decreased acids, enzymes, and motility can lead to SIBO. Dysbiosis, especially in the colon, can cause organisms to move up into the small bowel, and we can get SIBO or SIFO. But the SIBO and SIFO also create stress, more inflammation, more symptomatology, which that stress triggers more cellular hypothyroidism. And then once we have lots and lots of cellular hypothyroidism going on, we typically see the next phase, and that is autoimmune attack. And we see things like Hashimoto's, and then full-on glandular hypothyroidism occur. Okay? Hopefully that was helpful. If you have any questions, put them below wherever you watch this video, and look forward to more Thyroid Thursdays in the future. Okay? Take care.